Scott Brown, would you give us an invocation?
Father, we are thankful for this day that you've given us. We are thankful for the nursing home and hospital. We're thankful for the health care that they provide and the employment opportunities that they also provide. We ask that you be with us as a board to help us to make decisions that will benefit the whole district. Put aside our individual wants and desires to try to do things that will help the entire district. We pray these things in Jesus' name. Amen. Amen.
Okay, the first thing on our agenda is an open forum, and we invite anyone who would like to give your comments, or make a statement, or read a letter, or whatever you'd like to do. Whenever you do it, please stand and give us your name. Okay, who's going to be first?
I'll be first.
All right.
I had to put my parents in the nursing home, both of them at the same time, back in January. And it was the hardest thing I've ever had to do in my life. I felt like a failure as a daughter because I'd always said, you know, I'd never have to do this. But I think I was talking, I believe it was Dell Griswold had made a statement, and it's rung true to me. Before I had to put my mom and daddy in this facility, I didn't really know what everything went on in the nursing home. But I want to tell you, from the time I put mother and daddy in, Megan has bent over backwards to make sure Ruth was there, Christy, Janice, Joy, all of them came. And it was just like I wasn't by myself. Jack and I both, if we hadn't have had the help of these people in this nursing home, and then Betty has come along and has just been marvelous. Marianne, she has gone up and above. I was in Colorado last week, and Marianne even called me to tell me that my mama ate good. And this has been an issue. But I want to tell you, I've never experienced anybody like these folks that I have worked with. Megan has gone, she made a statement to me. She said, if you have an issue, if I don't know about it, I can't fix it. And in my behalf, in my dealings with my mom and dad, I've had nothing but positive. Has it been perfect? Absolutely not. And if it's perfect, then I want to look for Jesus, because that's the only place it's going to be perfect. And but I do know that Megan and the staff has been nothing but great in behalf of me, my family, my mom and dad. My brother is a retired fireman out of Richardson. And he came up, and he's been to a lot of places, a lot of nursing homes in that area, Dallas, Fort Worth. So when I called and told him about the decision, we both knew it was the right thing. He came up and visited, and the statement he made to me was this: I've been in a lot of nursing homes in the Dallas and the Fort Worth area. And he said, I have never seen one as tip-top shape as Parkview Nursing Home in Muleshoe, Texas. And I tell you what, I think our community of Muleshoe ought to be extremely proud of our facilities. Our staff has just been wonderful. I don't know what I would have done without them, and I sure don't know what Mom and Daddy would have done without you guys. And I want, for me and my family, Megan, thank you. Because if it wasn't for you, you know what? Jack has always said when we pastor the church, it starts at the top. It starts at the top. And if you've got a good leader, then you've got workers that want to work and help. And that's what we've experienced. That's from my point of view. And I thank Parkview.
Thank you, Deb. Appreciate those words. My sentiments exactly. My mother was out here, and my mother-in-law, and before this time, but this is a good place, and the volunteers that we have, they're just outstanding in this community. The people that come out here and help. And you're exactly right. Thank you. Who's next? Anybody?
I'd like to say something. Julian Dominguez, long-time resident, lifelong resident of Muleshoe. I think probably most of y'all know me. Born and raised here. My mother was in this facility as well. I didn't think I was going to get choked up. I want to just echo her words. I don't want to have to repeat everything she said, but everything she said is correct. I feel the same way. I come in contact with a lot of the Hispanics in this community. That piece that was written in the paper, you know, that's garbage, I think. I don't represent the Hispanic people, but I have talked to a lot of Hispanics in this community, and there's several Hispanics in this facility, and I think they're doing a really good job. I've spent a lot of time over here. I've worked in Dimmitt for a long time, worked in Farwell, and I was in those facilities over there. This is 100% better facility than most places will ever be, I think. My mom was in here till her last days, and I think they've done a super job, you know. So I think this facility should continue and should keep running the way it is now. No changes. I think they're doing a great job. I get a little excited, emotional, but that piece that I see in the paper was, you know, it's negative. Shouldn't have been there. It doesn't reflect what goes on in this place. All right.
Thank you very much, Judy. Well, we're looking at this report. We're going to go through it here in a minute, and we're looking at it as taking it as a positive attitude. Everything in there was written, all of it, but one item in there that she didn't object to. But those are things that were found by people that's their job. Come out here and find what's wrong. We're going to take this on, and we're going to correct all those things. And this place is going to be better after we get through than it was before. So we're going to have a really, really good place, I guarantee you. Who's next? Anybody else like to say something?
I'd like to say something. I'm Wayne Pearson, and I'm up for election in a week or two. And I'm very interested in serving on the board again, but did not take the opportunity to voice that through our paper. So just wanted to make that distinction.
Anybody else?
Yeah, Daniel Gribble, I wrote an article in the paper. It was published. I think everybody probably aware of what was stated in that. Just one other comment I'd like to make that hadn't been made is that uninformed people don't know what to do. Misinformed people have to do anything. Well-informed people have the opportunity to get the job done. And I think the real thing we need to accomplish here tonight is maybe a better realm of informing the community. And Muleshoe will fight for Muleshoe.
Thank you very much, David.
I'm Travis Copley. My mom spent 10 years up here before she passed away 10 months ago in this facility. Was able to see the progression of what it was when she got here to what it was when she left, and we all know how much better it's becoming. Another comment about the deal in the paper, I think is really, I think perspective is really important, and in my opinion, that was published without the public can have no expectation to have perspective of anything that was written, and in my opinion, it was done pretty harshly to favor maybe taking advantage of the public's perspective of what is and what should be about this facility, district, city.
Thanks, Travis. We have plenty of time, so anybody?
Well, I'm Jack Stone, and we did put Deb's mom and dad in here back in January, and I'll tell you this facility has been over backwards for us, you know, to keep us informed. I mean, even if her dad may run into something, the wall over somebody's foot or something of that sort, we're always notified about that thing. And I appreciate that because, you know, I look at this list and I feel like these things are able to be corrected, you know. I mean, there's none of us that's, it's like Megan always said, they're people working with people. And anytime you work with people, you will have problems, you'll have disagreements and everything. But I do know this, we can make it happen.
That's right. Thank you, Jack. Appreciate your comment. Somebody else? Okay, like I said, we're gonna go through this here in just a few minutes, and you're gonna be enlightened in some of the things that we're gonna talk about here. Going once, going twice, anybody. Don't be ashamed, we're all here, we're all neighbors, we all know each other, so nobody's gonna make fun of anybody, and your comments will be appreciated. Yes, ma'am.
I'd actually like to say something. I'm Christy Copley, my mother-in-law was here for 10 years, and I've been working here for well over a year, and I'm the ADON. And I had no idea what to expect and what went into the nursing home and the care and all that. And it's easy to make judgments when you don't know what's going on. And after I started working here and saw what it took to make this facility run, I was a lot more appreciative. And I am very proud to be a part of Parkview, and I think that if we get our community support in all ways, I think we're an asset. And
Right.
No doubt about it. Thank you.
I think the paper ought to report daily activities, go on here, positive stuff every day instead of just that one negative story that came out when the state came in and done their thing here. If they report everything positive daily, then that one negative item would cut.
Is that something we can do, kind of like the senior citizens does? We have a senior citizens has like a little comment section every week where they talk about what's going on with the senior citizens. Is that something we can have in the paper every week, the activities that are going on at the nursing homes?
we used to have that every week. When did it
The
stop?
nursing home stopped providing.
But is that open
That's
to?
possible.
Okay. Okay.
Can I say something else? I know I've already spoken, but I think something, I agree with this positive reporting to the newspaper, because back when it was so cold and these pipes burst, I'd like to see a show of hands if we was up here at 3 o'clock in the morning helping. Really, I really would.
I will shoot.
Well, and yes. How long were you up here, Megan? I hate to put her on the spot, but I would like this to be reported. She's not gonna say it. I heard that she was up here till 3. I've got a young man back there with her husband. Is that not correct? That is something that needs to be reported. You know, that is something that we ought to be proud of, that we have an administrator that doesn't think they're too good to get down and dirty.
Second
And
that.
I appreciate it. I appreciate it.
She was out feeding residents the other day. I've been in several nursing homes and I've never seen an administrator. Most of them sit behind the desk, and I'm sure they stay busy. They got a lot of things to do, but this one here, I think, is doing a really good job. She was out there with the rest of the crew, and she proved herself to me.
Next to a pastor's wife, it's one of the least appreciated.
Don't forget about listening,
I'd like to speak again. I was here that night that pipe froze and busted, that was a tragic time. But we've been under, since we had my mother-in-law and my brother-in-law here, we've been under 4 administrators, and I don't want to be negative to anybody. I don't even want to be negative to the paper. We need the paper as well as we need this facility. We all need to be able to come together. So, you know, I don't want us to get out on the paper either so bad. But on the other administrators we saw that were here any time we were, I never saw them on the floor. And I see Megan on the floor, and I've encouraged Megan even to do that much more. And I think that's a positive realm. And that's the areas that we need to work in, just being visible and communicating. And I would like to say, you know, I hadn't seen any other administrators on the floor anytime we was up here. And that, to me, as Jack has stated, it starts from the top and comes down. And That's the truth, you know, so when you see them doing their job, then you can expect the others to do theirs.
Thank you. Anyone else?
I guess I should say something too. I had a conflict that was kind of more of a family conflict and something that had to do with this facility specifically, but it involved my mother. And since they had to get involved in it, and Megan was contacted, and I just felt like she was really very empathetic in the way she dealt with it, and she helped us to straighten out some things, and it just really helped my whole family, not just my mother.
Thank you very much. Anybody outside to go with it? Most of those are good employees. Staying late again. They do that a lot. Ron, did you have something?
No.
Anyone? Okay, well, we'll call that session to a close, and we'll move on. And we thank every one of you for being here. We thank you for your support. We thank you for your input and more input. Megan's the person to talk to. And we'd like to emphasize that now when you have a problem, if you have a problem, take it to Megan first. Don't call a board member. Take it to Megan first and see if you can't get it worked out. And I think you can. Okay? All right. Next item on this agenda is Dale Griswold. We got to talking about moving the old carport that we own down by the hospital, moving out here, and Dale came out with a better plan. And Dale, if you'd do it, tell us what you came up with.
Well, for several reasons, I wanted to come up with a better plan. There's nothing wrong with the carport that you have for what it was used for, but for what we were wanting to use it for, it's not long enough and not tall enough, and maybe not even the right color. And this is a pretty facility. I was in one at Deleon yesterday preaching, and you go in there and the halls are narrow and small and short, and you look like you're in a coffin already. I mean, you know, and this facility's not that way, and the outside of this facility is a lot prettier. And I think we need to keep it that way, so therefore I thought we should do something that would complement it rather than take away from it. And we can purchase one that is tall enough and long enough. The one we have would be, it just barely cover the bus or the van, and wouldn't do a lot of help in the front and the back. And we can get one that's longer, a little narrower, and taller for $1,645. With a cost of another $200 to put down some good anchors to make sure that it stays here. Hello, we know West Texas. And we could even add some sides at $475 a piece for sides, you know, raising more even. But and then the one that we have, when it was new, its value would be $1,545, and we can take sealed bids, and I'm sure you know there'll be people interested in purchasing that and moving it. We were going to have to move it. At the time you spend the money, take that, you could take what we could get for it and add what it was going to cost to extend it in height or maybe even in length and secure it to the ground and get it moved, and you're going to be coming up with the same kind of money with not near as pretty a unit. And I think that this unit that we're looking at would be a whole lot more feasible to do because of what it looks like, and the compliment it would be to the nursing home. Another statement needs to be made is that it took a lot of work to get that bus, that transportation for the nursing home, and we need to take care of it. We know what the weather here can do. Even just the sun, you know, will do a lot of structural damage on a unit like that, and we can take better care of it, and I think that's our obligation, is to take better care of it. And I think this would be small money spent to take care of a large asset.
Very good. And what we're talking about is putting the carport out here to put that bus in under. And we've already had someone mention, Dale, that they'd give them around $1,000 to open, but we have to take bids on it. And so, you know, we're looking at putting maybe $1,000 in it. And Joy says she has almost that much money in the memorial fund that could be used for that. And actually, I think we talked to you about $600 or something, didn't we, Joel?
Maybe, yes.
So anyhow, we'll use memorial fund money for the rest of it, and then we'll have that bus in a nice covered facility. Are there any questions? Anyone have or comments? Better suggestions, Dave? We're always looking for better suggestions, aren't we?
Well, I think we could even have some fundraisers if necessary.
Good.
And in the community of Muleshoe, we see it with our livestock show, with a lot of things we do. And Muleshoe will support Muleshoe. And there's people that may not give you $50, but they may have an item that would bring $50 at auction or in a garage sale type thing or something. And I know that we can come up with the funds to take care of this need. I mean, I don't have any doubt in my mind that we can come up with the funds.
I don't either. It won't come, it can't, or won't come out of operating.
Without burdening anybody.
You'll have to come through the memorial fund or other donations. So if anybody'd like to make a donation, you're always sitting right there and she'd be glad to take it.
I'll make a motion that we approve this bid process for the sale of the carport.
Second that motion.
Motion made and second, all in favor say aye.
Aye.
Motion carried. All right, Megan, we're going to discuss this survey now. And all of you got one of these? Everybody get one of these?
I don't have one.
Here, you have one.
Okay. Got it.
Okay, Megan's we're gonna start at the top. She's gonna read this chart and give you a brief description of what happened. And I'm gonna say a little bit about what's written in this report. This is the report that we got from the Department of Health and Human Services and the State Department of what? State Department, what State Department?
Texas Department of Aging.
Yeah, Texas Department of Aging and Disability. 93 pages. A lot of it's duplicative. Some of it means it's been there twice. And I read every page of this thing, every page. And I know what's in here. And I want to tell you some of the things that are in here when she tells you about this, and you're going to be real surprised. Okay, start with number one there, mate.
Okay, we're going to start at the very beginning. There's no other place to start. And I'd like to start by saying thank you for your immense support of Part B tonight. And again, when you read some of these titles of these deficiencies, please take it very lightly and realize that, am I speaking loud enough now? Okay. Please realize that it's not all inclusive. So it's a lot of times just a very small part of the deficiency has to do with the title. F-tag 156 was a tag cited at an IJ. It was past non-compliance. And that was an instance that a nurse made a decision that she was not qualified to make. This was on an evening in November. And because of that, that nurse no longer works here. But she made a decision basically that a resident was deceased who had made the decision that they wanted to be a full code resident. And that resident, though they exhibited all signs of death, she should have initiated CPR because that was that resident's wish. And because she chose not to do that, we reported this to the state ourselves. We anticipated that they would promptly be in the facility, and they did not promptly come to the facility. We feel like that this was a nursing error. We do not feel like that this is something where that resident died because of this instance. This is an instance that the resident was deceased and then the nurse made a poor nursing judgment. And that is not something that the state has had us do a plan of correction on. It was a one-time incident, but we were cited, and this is one of the incidents that we as a facility could potentially be fined $5,000 for. So, are there any questions on that specific deficiency?
Tell them what full code is.
Full code is basically,
in the event that your heart stops, you would choose to have CPR initiated in this facility. Because not all of our nurses are required to be CPR certified, they would initiate what we refer to as life-sustaining measures. Those life-sustaining measures, as the American Heart Association defines it.
Chest compressions until EMS arrives.
So that is defined. A DNR would be, and Joy handles a lot of this in the residents, but a DNR is a do not resuscitate resident. That's a resident that has decided that in the event that they have a cardiac event, that we would not perform any life-sustaining measures.
Okay, what's your plan of correction on it?
Is there a chart readily available to all nurse staff to know each resident and be able to really make those decisions at a time of crisis?
Yes, that is all readily available. It's at the very front of the residence chart, and we actually had a coding system in place. But as you can see, we've moved the charts back to the center rotunda, and for HIPAA purposes, we are having to change some of that color coding. But it is very readily available, and Christy and Betty may be able to speak to that.
We're putting part of our plan of correction is to put a code in, like a coding system in place.
And that'll be just a simple color coding system. But if the second you go to that chart, the nurse flops it open and can tell at first glance what that resident's code status is.
Well, that clarifies that it was strictly a personal error rather than facility error.
Yes.
You know, if the facility has those readily available, then they should be clear of that.
Right.
And they just an individual mistake.
Is that fine still pending?
That fine will remain pending until the state, until we hear from, there's the state involved and then CMS is involved. And until CMS comes down and says, yes, absolutely, this is a fine, it will remain pending.
What is your plan?
There is no plan of correction, as you'll see on page 4. It's past non-compliance, and so there's no plan of correction required there.
It's already been corrected.
Yes.
Okay. And this is one of the things that just constant, continual training. It just requires constant training all the time. And, okay, what's the next one?
This next deficiency here is going to be F-Tab 164. And this goes over a curtain being partially pulled during a resident's incontinence care. The survey clearly defines that this care was provided when another resident was in the room. Both residents were cognitively impaired and not able to be interviewed, but again, one of the staff members went in the room and did not totally pull the curtain. There was a small gap where the other resident could see the incontinence care occurring. And of course, our corrective action there is just staff education.
Just more of the same. You're right. It just, somebody just failed to pull the curtain all the way around. And that's, and it needs to be done. There's no doubt about it. It needs to be done. It wasn't a life and death situation. All right, next.
F224, and this one is one of those things where it's a really ugly tag name. We failed to prohibit the mistreatment, neglect, or misappropriation, and it goes on to say misappropriation of resident funds. And this is a tag that we're really not proud of. This is one of our IJ tags. This was a tag having to do with our bus, and we are very proud of that facility bus. And we were not appropriately restraining the residents in that bus. We were restraining the wheelchair appropriately, but not the resident to the wheelchair. It's something that apparently has gone on in this facility for many, many years. No one was aware of it. The transportation aide that was involved here actually said, I've been doing transportation here for off and on for 10 years in different vehicles, and this is the way we've always done it. But we were not doing it correctly. And we were therefore immediately jeopardizing the lives of our residents, and we realized that immediately. We ceased all transportation until we received proper education on how to restrain our residents, and we are to date properly restraining our residents in the van. And this is when they're specifically being transported in the wheelchair restraint, when they're riding in their wheelchair. This is not when they're riding in their seats.
This is the first time the state has ever checked that.
Yes, yes, we have never, yes.
So after 10 years, this is something that was brought to your attention and was immediately corrected, and we got stuck with a really nasty sounding name tag over something that nobody understood? You didn't even know it was relevant?
Yes.
Well, it's very relevant, Craig.
Well,
Very relevant.
yes, I don't mean the restraint relevant. I mean the nasty, dirty, ugly tag that you take out of context and published for a world to see that don't understand.
Do we?
How do you restrain a transport?
There is, in our bus specifically, and Brian, I don't know where he went off to, is the expert on this, but basically what happens is there's wheelchair restraints in the floor that are locked down, and there's a track in the floor that the restraint locks to, and there's 4 restraints that come up and lock to the wheelchair. Then out of the wall of the bus, there's also restraints that restrain the resident to the wheelchair. So there's 2 parts to that. We were properly restraining the wheelchair, but then the resident was not properly restrained to their chair.
You haven't had this van though for 10 years though, right?
Right, but they've, I believe in different vehicles, they have always used the same type of restraint. Even the green van actually has a very similar type of restraint and functions in the same way.
This was brought up in this report 3 times, and we're very glad they found it and pointed it out.
Absolutely.
And it's been corrected, and it will always be right from now on.
And we are glad to report that through all of this, there is no record of a resident ever being injured in this instance. And we're very grateful for that, because there could have been a resident injured, but because of staff diligence and the grace of God, no resident has ever been injured during a transfer. So.
Back to the uninformed, misinformed, and well-informed.
Yeah, exactly.
Well, you know, the statement though, that neglect and abuse, that's just pretty rough for that. There was no neglect or abuse. It
Was a seatbelt.
was overlooked, and it's been corrected, and it will be forever corrected.
This is just something that the state is required to get this way, is that they're...
Yes, it's the terminology that they have to use for the name of the tag. And the tag is given any time that your facility fails to care for a resident in this way. And there's actually multiple tags that we'll discuss that are actually related to this very incident. And that is actually going to be your next tag. Tag 226 reads almost exactly the same as 224, but this is our failure to have a policy. We had no policies as a facility related to transportation. That is something that we're working on as a facility to establish new policies that are relevant to this facility. There's actually many of our policies that haven't been updated since the 80s. And that is just something that we're working to update, but obviously writing a whole new set of policy and procedures for a facility that is involved in so many things and for so many departments, that's just time consuming. And so as the need arises, we are updating our policy and procedures. So that is F-Tag 226. And that was also cited as part of the IJ.
Maybe, could some of these problems that we're seeing on these reports, of course, the language sometimes is Greek to us lay people. But then again, could this be due to the fact that we've never had an administrator stay very long? You know, so how do you get anything accomplished without some timeline?
Yes, sir, I think that could very much be part of it. And then, you know, our industry is ever changing. Our industry, I've been in the industry for 7 years, and it's not the same today as it was 7 years. It's incredibly different. And so to have the opportunity to stay up with the changes and then write your policy and procedure, well, by the time you write the policy and procedure, it's outdated. And so it's very, very challenging to keep up with our ever-changing industry. You know, the state's sending us new emails on a monthly basis with new regulations and new things that they're looking at and emphasizing. And so, you know, it's an industry challenge. Moving on, our next tag would be F tag 241, and that is dignity and respect of individuality. Some of these things that are cited here, most of us would find humorous, to be honest with you. Some of it is very nitpicky, but it is, again, an industry standard. Our tag here goes over our staff speaking Spanish in the dining room. What was witnessed by the state was that staff was speaking across the dining room in front of residents that were also English speaking in Spanish. And it would just be the typical human assumption that, oh, they're talking about me. And that is why the state sees that as a dignity issue. Also, we had some staff standing to feed residents in the dining room. And that is also a dignity issue that the state has a major issue with. And then we are notorious in this facility and just bad habits and being in a hurry for knocking as we were walking into that resident room instead of knocking, waiting for an appropriate response, and then entering the resident's room. And that was another part of that deficiency there. Another problem that seems to be a major challenge in our industry is using residents' proper names. Our staff was cited for referring to our residents as baby and sweetie, honey. And to us, that's a term of endearment because we live with these folks every day and they're a part of our family. But the state does not see that as that. They see that as a slang term that could potentially be degrading to our residents. And so, though we see that as a term of endearment, that is a big no-no in the industry and something that is very challenging for all of us to break those bad habits. But we are working on that as a staff and working to help hold each other accountable. But that's one of those rules as an administrator to me that I feel like that means my staff knows my residents, and I think that that's a positive thing. But we just have to agree to disagree with the great state of Texas on that one.
They observed one of the aides in the dining room helping one of the patients, one of the residents, and another resident needed some help. And so the aide got up and went over and helped the other resident and did not wash her hands before she came back to help the person. And they thought that was just pretty bad. Thank goodness she went and helped the person that needed help. Just things like that, things she mentioned that they wrote her up on pretty bad.
Call me sweetie anytime you want.
I don't think that'll ever happen.
But I have to, like my parents, they respond, and I think I have talked to some of the residents here. They don't respond to Mr. and Miss Murray. They respond to Papa and Mimi.
Sure.
Now, if you walk down there right now, and if you said Mimi, and she's got dementia and Alzheimer's is really bad, and it's getting worse. But if you'll say Mimi, she perks up just like that.
Well,
and
actually, we do have a place that we interview that asks them what do they want to be called, and that should be what we call it, okay?
And, you know, if these are people from a big city, you don't live in a small community and act like you're in a big city. I'm sorry. I'm sorry, you just can't.
You're gonna love this. Go ahead, Dave.
Is this not a home?
That's right.
It's a home. This is not just an establishment. It's a home. And at home, you're not called Mr. and Mrs. You're called Granny, or you're called Nanny, or you're called Mimi, or whatever.
That's right.
Hello?
When I take my mother over the house, she get tired of the grandkids, and she said, well, take me home. She never bring her back. Well, you're going to love this next one.
Okay.
If it's,
Yes. This next one, it goes over, are you on temperatures?
Yeah.
Is that what you're on? As you all know, we did have the flood, and when the flood came down, we had part of the hall taped off here, and the state had an issue with the temperature in the hall, and I think it was at 68 degrees. And then in the dining room, the other time, it was at 70.7 and 68.4. But we were tagged a deficiency on that because any facility certified after October 1st of 1990 has temperature requirements between 71 and 81 degrees Fahrenheit. So that is a deficiency that we did receive there. And that, our plan of correction there is we're getting new thermostats, digital thermostats throughout the facility, and Brian is going to go ahead and put a block box over that so that staff can't go in. You know, we have bad habits of going in and knocking that air down, and so we'll be able to stabilize that a little bit better.
But when we had frozen pipes, we had the ceiling out, we had a tarp down there, it was 68 on one side, I thought it was probably 48 on the other side. But on this side where the pages were, they said that was just too cold.
Usually hot for
The next one is about as fun as that one, and that is over the maintenance of comfortable sound levels. I have a really hard time being cited a deficiency for staff laughing. Of course, there's certain hours of the day and night that would be inappropriate, and certainly we would not want to be doing that. And also they cited us, and for those of you that are in our facility a lot, you know that our barrels are very loud. And we have made a very substantial investment to purchase new PVC barrels, and it's a PVC cart with cloth bags. There's no way to silence a rubber cart on wheels. And so it just has resonance coming down our halls. We've in-serviced our staff. As you know, we have no carpet. We have nothing in this facility that absorbs sound. Thankfully, we have wide halls and tall ceilings, but sound really carries. And we're working as a team to remind each other not to be having that conversation down the hall, as it's very easy to do in our facility as busy as we get. And we're just working on, you know, our volume as a team, and keeping that down at the nurse's station and up and down our halls. So.
Well, if you're talking to my daddy, don't think they're yelling from clear down there.
Again, it's a home, so how do you operate at home?
It's not a funeral home, it's a nursing home.
Yeah, well put.
Maybe a good idea for citizens to write to the state.
Well, from their point of view, the noise might bother them too, you know, because that's what they're.
And that is what the state's looking at, and there were resident interviews here that said that we were sometimes too rowdy. And at nighttime, I can imagine that would be frustrating, and you know, from down the hall, you don't know, a resident may not know that that's another resident being loud. So that is something that we're working on.
Should we have maybe had a state representative here in this meeting to?
At this point in time, there's really no undoing the deficiencies. There's nothing we can do to make them go back on that.
These are all items that have been pointed out that need to be corrected. They're going to all be corrected.
I understand it, but if, I'm just asking even from the point of view of them giving their version of why it was done.
I don't know that legally that they can even be here. I don't know how that would be seen. That they could even be here in this setting. It's a very strict environment. We can email them. They cannot return our emails. It's a very unique environment there. And so I don't even know if they would have been allowed to be here.
Privacy Act, in my opinion,
The next tab would be tag 309. And this is getting into some clinical stuff here. And this is on, an order was given on a resident to have the use of an abductor pillow. And Betty, will you define an abductor pillow for us?
An abductor pillow is a triangular shaped pillow. It's wider at the bottom than it is at the top, and it's used in hip surgeries most of the time. And it goes between the legs, then it keeps the legs at a perpendicular type, and it's strapped on. But the reason is to prohibit the movement of that joint that's been fixed. The particular resident that this was prescribed for was quite combative and quite vocal about having this placed on her, and the staff finally got to where they didn't even attempt it because of her agitation that it caused. When state came in, we still had the order on our MAR to use the abductor pillow. All it was a matter of contacting the physician that ordered it and explaining to him why the resident did not want to use it, and he gave us the order to discontinue it. But by that time, State had already caught it and it was a tag, so that's what that's about. Yeah.
That is deficiency 309, failure to provide care or services for the resident's highest well-being. Tag F312. This goes over providing ADL care for dependent residents. The state got us here basically for mail care and podiatry services. Our podiatrist had sent in a letter of termination, I believe the week before our survey. I hadn't even received it until the week of our survey. So our routine nail care schedule from the podiatrist, we were off schedule there. And our staff did not have a schedule in place at that point in time for when they were providing routine nail care. So we did have some jagged fingernails and things throughout the facility that had to be addressed. And that has since been put on a nursing schedule, and staff has been in service on that, and we are seeing good results from that. But that is the bulk of that tag there. And we do have a new contracted podiatrist. Our podiatrist services were coming out of Dallas. We're excited now that we have a podiatrist coming out of Lubbock. He comes in and he is able to bill Medicare directly, so there is no cost to us as a facility. And they will be here. They run a phenomenal operation. If you were here when they were here, you saw their room set up. They had about 4 different folks working, and they did a great job providing our residents care promptly. And we're even able to go into specific resident rooms for those residents that could not go to them.
They would come how often?
70 days.
Yeah, Medicare allows billing I think it's 72 days that they'll allow the podiatrist to be billed, so they will be out at quarterly at minimum. So that is deficiency F312. Are there any questions on that one? F323, free of accident hazards, supervision, and devices. And this is really just a system failure here at the facility. Many of you know that some of our residents use bed alarms and chair alarms. We had purchased an alarm type at that point in time that had a little tiny on-off switch at the bottom. And some of our staff was not informed as to how to use that alarm. Betty has since put in a phenomenal system. We have signs that inform the staff of how to use the bed alarm, how to use the chair alarm, and what residents require those. So those are being appropriately used on the residents that need them now, and that's something that is a fairly simple fix, but was something that we were failing to do properly. Is that the long and short of that one?
329. This is really important, 329.
329 here goes over our drug regimen being free from unnecessary drugs. And this goes over the psychoactive drug review that is done by our psychiatrist and pharmacy consultant. And this is something we have a challenge out here receiving good psychiatry services. The psychiatrist that does come in only comes in on the weekends, he's incredibly unpredictable, and his communication with our local physicians is challenging at best, and that is something that we're working on, but there are just very limited resources in this area for psychiatrists that will come out and see nursing home residents. We have worked through all of these issues that we know of. The specific resident involved is having a review done on a monthly basis, and reductions are being performed as recommended, and Betty's staff will be in service by...
Yes, this particular tag is going to be part of the state demanded in-service that is education-based. And I don't know how many of you are familiar with LIS tips. who's an instructor at the Clovis Community College School of Nursing. She's going to be coming this Friday and doing an in-service for my nurses over our drug regimen review that will cover this and 2 of the other tags that Megan will go on over later.
Do you have anything else to add to this?
Part of this had to do with our documentation of psychoactive behaviors. Anytime a doctor prescribes a psychoactive medication, it's on a PRN basis, which means as needed. If my nurses make the determination that that behavior warrants use of that drug, then they are responsible for documenting what was occurring when this behavior occurred, what caused the behavior, and what other interventions did you try to alleviate the behavior before you gave a medication. And that is something that we were not doing properly when the state was in the building, and that we are in the process of correcting at this time, and it will be an ongoing process that will evolve as we go along.
If you have any questions about any of these items, please let us know.
And the next tag is pretty well related. That is that the facility was not free of medication error rates of 5% or more. This is something that was very challenging to us. The state was being audited by the feds when they were here. The state, Beverly Briggs was one of our auditors, and she actually wrote the state's guideline for medication passes. She commented to Betty and I believe at one point, I believe it was Thursday during the week of the survey, that we were error-free. Then the next day, all of a sudden, we're not error-free. And so the nurse who was with senior...
Nobody noticed that.
So these, we were very confused on this, but now that we've seen all this, it is a little bit more clear to us. Some of the big things on this was just our practices of being in a hurry around here. Nursing staff providing medication without watching the resident fully ingest that medication. And so that is just changing some habits that we have around here and our fast pace that we have to work at. All of the specific issues with each resident have been addressed, and a lot of that is documentation. It's back to paperwork there.
And this is also one of the tags that state will be included in our in-service this Friday with list tips.
So we're working to clarify that. Betty and Christy are working on a giant project of auditing our med carts to our physician's orders to our, what we refer to as our MAR, and that is our medication administration record, the large document that you see the nurses using as they're going throughout the facility. This will also be included in our in-service schedule, so biannually we will be working on and in-servicing our staff on these topics.
This is something that really needs correction right there. That's the only thing on there I was really concerned about was that.
And a lot of this too, and I think we have staff in here that can speak to this. When you have a surveyor with you, it's very yes. And Scott even mentioned several times when those federal folks are in here that it's awkward when they were around in the dining room. You know, they're just lurking around you all day, every day. They're all over the facility, following our nurses on their tails. And I think a lot of the mistakes made here were not typical day-to-day mistakes made. They were mistakes made out of nervousness and intimidation.
The state surveyors were in tears at some point because the feds were so intense on them.
What you're saying is the state auditors were being audited themselves also.
Yes.
So you got a quadruple whammy.
Have any of you had to give your parents medicine before? Or it's just like giving your children. There was one item on here where a medication was being administered and they were crushing the pill and putting it in a grape jello or something, and they watched this procedure, watched the nurse do it, and then they wouldn't retrieve the cup out of the trash and there was a little chunk, a little bitty piece of the pill still in there with some of the grapefruit, and they wrote her up for not giving her all of the medication. And but, you know, this is what the most important thing in this thing, see all these things correct and everything.
Okay. We are moving on to our dietary tags, and tonight we have Miss Sue Smith here. She is our dietitian, and she's absolutely wonderful. She coaches Marianne and I through a lot of things and answers a lot of crazy questions and all kinds of good stuff. And she has actually already come in and worked on in-servicing our staff. And this is a tough tag to take. And Sue can probably speak to it somewhat better than I can, but it's objective.
It exactly. It's everybody has their opinion, and I have done meal rounds, and one resident complained everything's too salty, and the next one across the hall it doesn't have enough taste to it. You know, that is truly, this is the toughest thing that is palatability, because it's like I say, everybody's got their own opinion about it, and it is real tough.
I can even speak to my experience today. I ate the mechanical soft plate today at lunch because I had a resident in my office saying lunch was terrible. So I marched in the dining room. Marianne makes me a plate. It looks lovely because it's the ground mechanical soft plate. And I guess I was hungry because within about 5 minutes it was back in her office and the plate was clean. And I thought it was pretty tasty. So, and even being the mechanical soft version of the plate, I thought it was wonderful today. And there was a resident who disliked it. And so it is very hard to please our residents all the time because it is 50 different tasters going at it, tasting this food. One of our biggest challenges, and I think on this one it was on our food temperature. We serve about 25 fried eggs every morning. That is unique, to say the least, that a nursing home would even attempt to serve fried eggs. It's something pretty well demanded by a lot of our residents, and something for a lot of our residents, it gives them the calories that they need to keep their weight on, and so that's why it's important to us and something that we're striving not to eliminate from our day-to-day routine. But keeping 25 fried eggs at 160 degrees, is that where they need to be? 140. It's a challenge at best. We have purchased new plate warmers that go not only on top of the plate but under the plate to help keep the plate hot, to help try to keep those eggs as hot as we can. Sue has come in and done some education with our staff. You know, when you cook something and then you have to mix it to make a pureed plate, you know, we don't just serve regular food. We served a chopped mechanical plate, and then we also serve a pureed plate, depending on the resident's need. And it's very hard to maintain food temperatures when you have to do that. So it is
and transported down the hall is another compound, and it's not just the dining room.
Right.
Let me read one of the comments. You'll love this. The facility did not ensure the eggs maintained their temperature for a time while residents were eating, and the pureed coffee cake had a desirable taste, temperature, and texture. I don't know how you can pureed coffee cake and make it any kind of good. But that's what they're up against.
One of the other things is we have a 28-day cycle menu. So it means we don't repeat the menu for 28 days. And so that has been a big challenge too with employee training, which we've had quite a bit of cook changeover. And which is typical food service in a lot of areas too, but it has been mighty severe lately. And so when you think about it, you're training a new employee, it's not to do the same thing every day. It's 28 days before they even see that recipe again. And so when you've got turnover of every month or two, that compounds it excessive. We have only one cook and one aide, plus Marianne, that's doing all this. And so if you want to think about frying 25 eggs and another scrambled 25, not to mention, you know, the 3 textures she's talked about, but the therapeutic diets, okay, which require 2 or 3 different desserts, low fat, diabetic, cholesterol, We do have as liberal of diets in our geriatric population, which I'm totally in favor of, and get most of the docs. Sometimes we have to have little discussions, but most of them agree to that. I mean, when I get 80 years old, I'm going to eat what I want, and I'm not getting up at 6 o'clock in the morning to have breakfast either. So I believe in liberal diets, and breakfast is the best meal for most of our geriatric population also. So that is one of the reasons that they do bend over backwards to do the fried eggs and to get them there. But the temp holding is a challenge.
Let me just inject something here, because when we had to place Deb's mom in the hospital, she had dehydrated and lost so much weight that the last checkup that she had here,
This was before she was admitted to.
right before she was admitted here, but she had gained, since she's been here, she's gained that weight back, and she's right where she needs to be.
They keep, doctor keeps up with that, the weights and.
Well, I'd like to say one thing too. We have had our parents here for 6 months, and of course our mother just recently died. But we've eaten at this facility numerous times at different times of the day. And every meal that we've ever experienced has been top notch. And I can't say that about some of the other facilities that I have eaten at. My mother-in-law was in the Freona facility, and their meals were good, but not every single meal was top-notch. But I've never eaten one that wasn't here. And I think that the dietitians and the cooks and the help needs to be commended for that.
I'm sorry, I bet you, your name is?
Me?
Yes.
I'm Jan Thompson. I'm the oldest daughter of Dwayne and Jewel Darling.
Oh, okay, thank you very much.
All right, is there any other questions on that first dietary tag? We'll move on to 371. This is another dietary tag. This one's kind of one of those food for thought things that we are working on with staff training. This has to do with some leftovers being left on the counter during the day when State was here that shouldn't have been. I don't know about you guys, but it's a tough thing. I'm probably guilty at home. I've probably fed my husband plenty of things that I shouldn't have fed him. I think that, it just is one of those things in the kitchen that takes place. And we goofed and we take ownership of it, but I think our staff is very well aware of what happened and has grown from it. There was some stuff left on the counter, and it didn't go back in the fridge in a timely enough manner. And so the temperature had dropped. Also, through this process, Mary Ann and I are working on some different checklists. I'll be spending more time in the kitchen going through some of this, and then she'll have a daily regimen of checklists that she's going through there as well. We had one of our staff members who touched the doorknob several times without going back and washing her hands and re-gloving. And that is just an education process that we are working on. And it is something that, again, when you've got 5 surveyors flying around your kitchen, I think you're probably more apt to make mistakes than you would be on a day-to-day basis.
There are a lot of little things they pick up in the kitchen. The glasses weren't drained properly, or sitting flat on the counter, something like that. There are a lot of things. They're gonna have to be corrected, and they will. It just takes training and time and effort.
One of the portions of this deficiency, our cups go through, of course, a heavy sanitizer process, and after that, because it's so hot, they do hold condensation, and they weren't properly drained on a surface that allowed that condensation to come out. And then there were some chips on the edges of some of those plastic cups that we use. And so we are going through our equipment and making sure that anything that does have any need for repair is being taken care of.
How do the restaurants get by with those chip bags? I'd like to make one more statement. I hear a lot about staff and maybe making mistakes and things. We're all gonna make mistakes. But you know, I think one of the biggest problems with most businesses of any type, including this one, is the failure to recognize that good employees are an asset, not a deficit. And I think that's why this meeting was really important to me. I wanted this meeting real bad. I talked to Bill and David as well, to get this kind of a meeting together. Because I think if we're unable to give them the funding financially, we need to at least give them some support and tell them when they do good, you know, to kind of increase that desire to maintain.
Well, as you know, and I stated in our meeting Thursday, and I've stated many times, we've kept these facilities open, this place and the hospital, on our employees' backs. We haven't had a pay raise in 3 years because we've been trying to get over this financial crisis we've been in. Tremendous financial crisis. And we know how good our staff is, and we know they work hard every day. And soon, not just one of these, soon, we're going to get to the point where we're going to bring them up to snuff on their wages and salaries. And they've been very patient with us and have continued to do the best they can.
Moving on, we will go over F-Tag 425, pharmaceutical services and accurate procedures. This is going to go over, a lot of this is documentation. We actually disagree with a good portion of this tag. The big thing that the state wants to see is, as we mentioned before, that our medication cart, our medication administration record, and our physician's orders all match. Those physician's orders by the state standards all need to be in the chart. When the surveyor asked Betty what it would take for her to
ensure that each physician's order to support everything on our medication administration record and treatment administration record was in the chart, I just said a wheelbarrow. Because my nurses wouldn't be able to lift the charts. We are required only to keep, we print off a updated set of physician's orders every month, and it runs for that entire month. That set of physician's orders are sent to the doctor. He signs off on the order. We have to keep nothing in that chart prior to that. He was upset that we didn't wrote us up anyway, so.
And Ruth Ann can tell you, I don't know if y'all know what all Ruth does, but if you go back in her back office, we have residents who have been here for many years that have files upon files of medical records. And it's just part of the business. We're not electronic yet, and that's really not on the horizon for long-term care at this point in time. So we have a lot of paper documentation. And so it does build up. And being able to keep that physician's record, and it could have been from quite some time ago, on the chart is very challenging to keep up with. And so that is a part of our issue here. A lot of this other stuff really was pretty simple fixes. Some of it was medication administration errors, and none of them were life-threatening. They were all relatively minor. A lot of it refers to something as simple as a resident being given a multivitamin with minerals as opposed to just a regular multivitamin.
Can I clarify that they were not medication errors in the respect, we did not give the wrong amount of medication or give the wrong medication. It was documentation errors. When you have a narcotic like Phenergan with codeine that we use for nausea and vomiting and sometimes cough if the doctor orders it that way, when you give that PRN medication, you have a narcotic sign-out sheet that you have to sign where you gave that dose. Then you have to go to your MAR and initial that you gave this dose at this time. And some of our nurses weren't, they were documenting it on one record but not on the other. So that's where we were falling through the cracks on those. So it's different than a med error. It was more documentation errors than it was actual medication.
And this is another deficiency that the state is requiring that we have a third party come in and in-service on, and that is what Ms. Tips will be here for Friday's in-service education. So, are Are there any other questions on that one? The next one is F441. This goes over infection control, prevention and spreading. This is probably the tag that has most got under my skin. This is the tag that I, as an administrator, am the most embarrassed of. We had some issues going on in a resident bathroom. I don't think that our staff intentionally allowed this to happen, but we had a resident with an open wound who was subject to urine and feces on the floor. And that is something that we have educated our staff on. Our CNAs have been read explicitly this survey, and Christy is working really hard to educate the CNAs to this issue. And I feel like it was probably a one-time event again, with us maybe being nervous and a little bit on edge with the state and the building, and we did fall short here, and it is something that we are working very hard to correct. Some of this other issue goes over proper hand washing techniques. If you've been in our building, you've seen us all use our hand sanitizer. We're really good at that. The state says after 3 uses of hand sanitizer, you have to wash your hands. And so that is something that they would sit at the nurse's station and would watch a staff member go in and out of a room, go in and out of another room, go in and out of another room, and they did never see them wash their hands. They saw them use that hand sanitizer very loyally, but they didn't wash their hands. So that is what we're working on. We've got some very specialized in-service education coming in over infection control, and it is something that we have educated our staff on the importance of that. We have very good infection control records, and really don't have a lot of infection control issues here in the facility. Nothing out of the ordinary, certainly for a facility that has 50 residents.
They use gloves each time they go in, they did when mother was in.
Yes, they use gloves.
You're supposed to wash your hands with every time you.
Yeah, between gloves.
Okay. Is there anything else on this one, Bill, that you want me to address? Is there anything? Okay. F465, this is a long list, and actually I gave Brian a checklist that was about 2 pages long today. And this just goes over a lot of very simple stuff. Damaged wheelchairs, any wheelchairs that have a tear to the arm, simple things like that throughout the facility, oxygen concentrators having to be spotless. I could really go on and on this one. They got as particular as to very harshly critique our beauty shop here in the facility that is ran by volunteers, but and we certainly appreciate their work, but that is just little environmental things throughout the facility that have to be addressed. I do have to commend Brian. He came in, didn't have very many months to get this facility in shape before our survey, and our life safety inspection was deficiency free. We ended up with 1 life safety tag, and it was something that the health team actually caught, and it was a door that was a resident room. It's now used as Joy's office, and it's part of our smoke wall, and it has to have an automatic door closer on it, and the door has to be closed at all points during the day, and that door closer had been removed. And so we now have a door closer on Joy's office, so Joy will be here a lot of times with her office door closed. So knock on her door if you need her. And but that was our 1 life safety deficiency, so we are very proud of that. A lot of this stuff is wall damage in hopper rooms, wall damage in janitor closets, very minuscule little things that we just have to keep up with around here. Our next tag, F490, is our administration effectiveness resident well-being tag. It reads exactly as F tag 224. Anytime that there is a substandard quality of care or IJ tag noted, my license is referred. So I will be going to the state and defending my license as an administrator. Oftentimes they will make me have more CEU hours. Oftentimes they'll just write it off and not make me do anything. But that tag reads word for word like F tag 224. So, and that is because that tag was cited at such a high scope and severity.
I actually would like to say something. When we got that tag, I was just amazed at how quickly Megan, we got it fixed. I mean, the inspectors were shocked at how quickly we got that into effect. And I mean, we had a policy written like that night. I mean, she was on top of it, and I was very impressed with how she handled that, and it was handled very quickly.
We did go into IJ at about 2 o'clock on March 16th, and I believe this actually shows us being out of IJ by 6 o'clock. And so that is where this tag comes from. Those of you that have worked in long-term care and understand that, that is amazing for a facility to come in and out of IJ that promptly. So we are proud of that, and that was a huge team effort. I don't think there was a department head here that was not tasked to something to make that happen. And though we're not proud of that deficiency, we were in and out of that deficiency very, very quickly. Our final tag is F tag 502. This is another one of those that reads really terribly, and it was a very minor deficiency. Failure to provide and obtain laboratory services in a timely or quality manner. And that goes over our glucometer.
Glucometer testing.
And the glucometer is what we use to check our residents' blood sugars. And it was not being calibrated properly. It was not reading the wrong blood sugars. It just had to do with calibration of the glucometer. It read low, and it shouldn't have. And we have since resolved that issue. We are working on ordering new glucometers that will more frequently not have calibration issues, but we were not failing to obtain lab results or anything like that. That is just the deficiency that you receive in relation to that glucometer testing. That is not something that we feel jeopardized our residents in any way. It just is one of those things that is a learning curve.
Any comments? Questions, suggestions?
I'd like to say, I think this has been a very positive meeting. I think we've accomplished our goal. I think we're getting information out due with the paper and Channel 6. I think we've all come together in a very positive manner and seen that there has been some mistakes made, that they're being corrected, and that we can pull together as a community in support of this facility that we desperately need. And I think this has been a very successful. I'm impressed with everybody that showed up and with the comments that they've made. Thank you.
One more, where's that sign-in sheet? Anybody know where the sign-in sheet is?
I have it.
Anybody that didn't sign that, you have to sign it before you leave. Just kidding, please sign it. We thank you very much for coming tonight. We thank you for your participation. And we may meet out here more. We've got a lot more fans out here. We get a bigger room though. But thank you very much. If you have questions, you have problems, take them to Megan. If you don't get satisfaction with Megan, then come to us. Please take them to her first. She's trying her best. We know she is. And we're trying to support her and support this facility. And what we need is more residents. Most of these things on here are because we are working with a minimum staff. Because of the financial crisis we're in. If we can get more residents, we can hire more staff. So please talk it up, tell your friends and neighbors that need to put somebody in a really good facility. This is it, and we'd love to have it. Yes, Trevor.
It would certainly be beneficial if our things like our local newspaper carried that same sentiment. It's easy to see how what was published, though it is correct and was right, And there wasn't anything misspoken about it. It's just out of context to the reality that things are not as bad as they were made appear, in my opinion.
Thank you very much. Thank you all for your participation. I need a motion to adjourn.
Make a motion, we adjourn.
Motion made, second, all in favor say aye. Aye. Motion carried. Thank you again.
Cake and cookies too.
Thank you.